How about today? This has been a great lineup of speakers. This is not every day you find this amount of information. Check. Check. Is this thing on? Check. Danny Atkins, the superintendent. I don't know that this class is different than the preschoolers you had this morning. All right, we're going to get started. It's my pleasure to introduce this next guest who, and the panel, but specifically Kayla, who's moderating it. She's a benefactor of some partnerships that we helped develop, and there's a great video. If you go to theresafuture.org and search her name, you'll find a video that shares a little background on her story. But we worked with Addiction Recovery Care, a group out of Louisa, Kentucky that has residential and outpatient centers. We helped them coordinate with some workforce partners to create a peer support academy where they are training people who are in treatment or going through recovery in their programs to become peer support specialists. Long story short, this next moderator came through that program, graduated from the Peer Support Academy, and that's just incredible for us to see things that we just kind of had on paper at one point as ideas, and see now lives being impacted and changed through those programs. So great story. If you go to theresafuture.org and look for her, you can see her background. She was sharing with me earlier, last year's event was her first event she went to, being in the corporate offices at Addiction Recovery Care. She is now the Deputy Chief of Staff for Projects and Development for Addiction Recovery Care, and we're honored to have her here today moderating this panel. Welcome, Kayla Parsons, to the stage.
Hello, like you said, my name is Kayla Parsons, and I'm Deputy Chief of Staff for Development and Projects for Addiction Recovery Care. Treatment needs for substance use disorder or addiction can look different for each person and should be individualized to meet the needs of the people where they are. But most importantly, everyone, individuals, family members, and healthcare providers must know how to get help, not have to wait to get it, and have access to health care that recognizes addiction as a disease. Our panelists today are on the front lines of the opioid crisis and are leading the nation in innovations that are changing the way that treatment is accessed. Dr. Van Breeding is the Director of Clinical Affairs at Mountain Comprehensive Health Corporation, one of the largest rural community health centers in the U.S. He provides services to over 30,000 patients in eastern Kentucky every year. He is an assistant professor of family practice at Kentucky College of Osteopathic Medicine, the University of Kentucky, and Lincoln Memorial University. He has served as a diplomat on the American Board of Family Practice for 17 years. In 2017, he was Country Doctor of the Year, and in August this year, he was named a Healthy Kentucky Policy Champion by the Foundation for a Healthy Kentucky for his leadership in fighting the substance use epidemic through his leadership, coordination of services, community mobilization, and establishment of an action-oriented multi-sector community response initiative, HEAL. Courtney Maynard is a graduate from Eastern Kentucky University with a bachelor's in psychology. She began her master's in social work this August and is actively working on getting her certification as an alcohol and drug counselor. She has acted as a substance use counselor for a facility geared toward the recovery of pregnant women, a family preservation specialist, and a child protective services investigator for the Cabinet of Health and Family Services. She is currently a screening and referral specialist for the Kentucky Help Statewide Call Center, coordinated by Operation Unite. She has worked this last year with the statewide call center to help create its core functions, database of resources, and helping guide those that call toward the treatment modalities that best fit their needs.
1 year ago, I found a 20-year-old young man behind my church. He had a needle in his arm, he had overdosed, and was dead. He'd gone to the local Quick Mart at midnight, got $100 from the ATM machine, bought a Coke and a candy bar, made a drug deal in the parking lot, drove to behind my church, shot up, and died 30 minutes later. Finding that young man changed my life. It made me realize that the ownership of taking care of people with substance use disorder falls on our shoulders as primary care doctors and not to be shelved on to other people to take care of. 4 people today will die from overdose in Kentucky. 1,500 last year or more. This is a crisis that we have to take care of as our own communities and our own providers. We can't rely on grants, other people, outside organizations to take care of this. We have to do it. It's our job, it's our community, and we share the responsibility to take care of it. In Letcher County, we got together. At first, there was 3 of us. We created HEAL, Help End Addiction for Life. Last night at our HEAL meeting, approximately 15 meetings after we started, we had over 100 people there. We're doing good. We're defeating addiction. Addiction is losing. HEAL is a coordination in our community get the next slide. That we sought out everyone in our community who was working on substance abuse disorder. We found a lot of redundancy, a lot of people trying to do it on their own. We found a lot of innovative ideas, a lot of good being done, but no coordination. So we started inviting people to attend our meetings, and we grew, and we grew. And we grew to over 60 different organizations working in our local county that were working on addiction. There were some that were good at needle exchange, some that were good at counseling, some were good at MAT. We had to find out what their niche was and how they could work together. And by using our local resources without any additional funding, working on people's strengths, and sharing the load, we have come a tremendous distance in just 12 short months. Our goal was to create a seamless network, a safety net, so that wherever you entered the healthcare system, we could get you immediate help. It doesn't do any good to tell someone who's wanting to recover, we'll help you out, but it's going to be 6 months before we can do it. It needs to be that day, and that's our goal. When we see someone, we approach them, we envelop them, we take care of their medical needs, their physical needs, their healthcare needs, their insurance needs. We get them treated for substance use, and if they need inpatient detox, residential rehab, or outpatient treatment, we get them started that day. We don't wait. The urgency is there. We have to act now because it's a short window of time when people are ready to quit and give up addiction. We focused our attack in 4 areas: prevention, education, treatment, and recovery. We thought by working together in partnerships to attack addiction and substance use disorder in this manner that we can make a big difference and make it quickly. In prevention, we sought out drug disposal kits through the Kentucky Attorney General's Office, Operation Unite, and looked for those unused opioids that were lying around the medicine cabinets all across our county that could addict young people to drugs. We know it's a source of a lot of teenage addiction, is finding an old prescription for wisdom tooth pain or sports injury and getting started into the downhill road of substance abuse. Our county attorney championed the Give Me a Reason drug kit. It's sponsored through Unite. It offered parents the ability to drug screen their children at home to see if they were on drugs or not. But on the other side, it also offered that student the opportunity to hold off peer pressure to use drugs. I can't use drugs because my parents are drug screening me and I'll be in deep trouble. Those kids have been a huge success in our county and through our school system. We also championed with our health department to start a Narcan distribution center. And the Kentucky Board of Pharmacy truck, I think, is here today. And up until they come to our county about 3 months ago, they usually give out between 15 to 20 doses. In one afternoon, we gave out 188 doses of Narcan. Narcan saves lives. You need to go today and get your Narcan while you're here. We also work with the health department to get needle exchange going. So important to prevent disease by using clean needles. Our program got going here in April, and we have over 75 regular repeat users right now in our county, with hopes for more as we proceed on. We next turn to education, using our partnerships. Local media, local newspaper, TV, radio stations did numerous public service announcements about substance use disorder and treatment, recovery, hope to improve the situation. We partnered with a grant from Unite with our local substance use prevention group and had the local community college drama group called Higher Ground develop a play about needle exchange. It was called Needleworks. It was tremendous. I met Kayla at the first one. She came and talked from ARC and told about her stories. But Kayla will tell you that that needlework play was life-shattering. It's amazing. Over 30 people involved, half of which are recovering addicts, are in this play. We brought it here to Pikeville and did it before the second year medical school class last fall. It was tremendous. It's done a lot of good. We have a music program called 11 Amp in our community, and we had the first performance accompanied by a push to educate the people attending about substance use disorder and about the HEAL Project. We work with Unite in their school and after-school programs for both parents and children. And the most important thing that I think we did with education was that we asked every medical provider that works for MCHC, and we have over 60, to take the waiver program, the waiver education, so that they could write Suboxone or other MAT, medication-assisted treatments. We didn't tell them they had to prescribe it. We just wanted them to take the program to educate them. They took the program, educated themselves. We started out with 3. We now have 9 providers working through MAT at our clinics. That program is a tremendous education course. It tells you all about addiction. It tells you how things have to work and how things go. So I encourage everyone that's a medical provider or trained to be one to take that course. And hopefully you'll get your waiver license and start prescribing and start treating. We've had lots of success. And when we look at successes, we look at not necessarily that somebody's going to be sober or absent the rest of their life, but that they're going to be functional. Functionality. Is it better that someone be on Suboxone and break over and use some meth one weekend, or is it better that patient remains on meth, cocaine, heroin, marijuana, and Suboxone? So it's all relative. We hold people with addiction disorder to a higher standard than we do our other patients. When the diabetic comes in, their A1C's 10, we pull them closer and treat them with better treatments to get them down. The substance use disorder person gets kicked out. We cannot do this anymore. We must pull these people closer and treat them and keep treating them through relapse, through remission, until we're able to get them functional and working and back into the workforce. Thus far, we've had, starting in February of this year until the end of September, 118 patients in MAT with Suboxone. Our needle abstinence program started in June 2016 and up to date has had 141 mothers treated. Initially, before treatment, 90% of our addicted mothers' children required long-term hospital stays for needle abstinence syndrome. We're down now to less than 10%. Treatment works. Needle abstinence works. It needs to be done everywhere, not just in our county, but in every county. Our new exchange program through the health department is up now to 75 users in Letcher County, over 300 users in Alsa County. We're working on getting the program started in Harlan County. Needle exchange works. It saves lives. It prevents the spread of infection. It helps cut down on cases of hepatitis C and HIV. We need it everywhere. More examples of our success come in treatment. Our third wave of working to try to improve substance use disorder: prevention, education, treatment. We didn't know anything about detox, but we learned. And so we opened our own detox unit using our family practice and internal medicine doctors at our local hospital, and we now take care of detox. If you come in overdosed, you get admitted, you get treated, and while you're there, you get evaluated for medication treatment outpatient or residential rehab. So we're on top of that right there in the emergency room, so doctors know where to send patients to. Our MAT at the clinic continues to grow with more and more providers working toward that. We have behavioral health at our clinic, and so we utilize them for substance use disorder counseling. We also use our local community, Kentucky River Community Care, for help in counseling. So we're able to manage it right there at the clinic. So you can come in today and say, I need help, and we can get you help today. Not tomorrow, not next week, not next month. We partner with addiction recovery centers, and we can get patients into rehab, into residential rehab, within 24 hours. We have had 3 people go through our program who completed the program, got functional, did the education training, and become peer support specialists, and now work for us, earning a wage, making a living in our own county, helping others to recover from addiction. Our Vivitrol program has grown to over 50 patients, utilized in drug court and also for alcoholism and for substance use disorder. And we continue to learn more and more new treatments daily. Sublocade, a new injectable, long-acting buprenorphine. We used it in our first patient 2 weeks ago. So we're on the edge, but we're not addictionologists. We're primary care doctors. We're family practice. We're internal medicine. We're OBGYN. And we're not out seeking patients. We're taking care of our own patients who are going elsewhere for care. It's our job as primary care doctors to take care of our patients, not someone else taking care of our patients. And our fourth attack was recovery. Increasing recovery and support programs in our own community, AA, Al-Anon, Narcotics Anonymous, creating transitional housing like Mitch McConnell talked about, working on jobs through Kentucky Accept, getting people GEDs and graduating them from college and high school, working with case management, peer support. These are all vital to a fully enveloped program that we're offering. Our meetings have grown. Like I said, we started out with 3, and in just a year and 4 months, we're up to over 100 people attending meetings. We spread from Letcher County to we have a HEAL unit in Harlan County, one in Prairie County, and one in Alsa County. We want HEAL to be all across Kentucky, not because we own it. We want the community to own it. We want you to take care of your own county, your own community. We have a website and a Facebook page. I encourage you to turn to it. We try to do all of our programs live so you can watch them while we're doing the program. Our next program is January. But thinking back and in conclusion, the title of today's program is Turn the Tide. And when we think about that, how can you and we make a difference? Number one, you can work in your local community to focus efforts on treating substance use disorder. Look at the same 4 tenets we did: prevention, education, treatment, and recovery. Number 2, as healthcare providers, learn about addiction. Learn about the disease. Learn about treatment. Take the waiver program. Get your license. Start treating people. Start treating your own patients. Number 3, we've got a lot of students here and a lot of educators here. Make sure your curriculum teaches you about the disease called substance use disorder, about the pathophysiology of it, about the pharmacology of it, so that when you leave here, you're armed with the tools you need to start treating your patients yourself. Don't rely on other people to do it. It's your job. Number 4, a new program has been developed by Addiction Recovery Centers. It's called Certified Recovery Connector. It's a 3-hour program. You go to Louisa to Karen's house, which is a residential recovery house for women. Take a 3-hour program there. When you get through the 3-hour program, you're certified. You're given all the tools you need, so if someone comes up and says, I need help, you can connect them to help yourself. What better ability can we all have here to be able to do that on our own? Not send them to the hospital, not send them to addiction recovery, not send them to my clinic, but to do it yourself. You'll have all the numbers and information you need. So you need to do that. And I'd encourage every one of you, student, physician, layperson, educator, whoever's here, go take that course. Look it up at Addiction Recovery Centers. They offer it every Saturday. And number 5, as I talked about earlier, the Kentucky Pharmacy truck is here today. Go down and get your dose of Narcan. Who knows when you'll turn a corner or pull into a parking lot and find someone overdosed that you can save their life with a dose of Narcan that you carry in your pocket or your car. Everyone needs to do that today. So we had the largest one in Weisberg at 188. There's a lot more than 188 here. Run them out of Narcan today. Make them bring more. So go do that today. We need your help today. Not next week, not next month, not someone else to do it. We need you to take charge and take control and help restore our communities and our families and our children and our patients who are suffering from this addiction scourge. So go to work today. Addiction is losing. Thank you.
Good afternoon, everybody. My name is Courtney Maynard, and I'm a screening and referral specialist with the Operation Unite Kentucky Help Statewide Call Center. Some of you may not know what that means, and many people have called the screening and referral specialists counselors, social workers, case managers, and none of those would be wrong. We try to be whatever it is that the person on the other line of the phone needs. We are a relatively new service of Operation Unite that covers the whole state of Kentucky. We offer various treatment modalities throughout the state that callers and individuals, family members, loved ones that are affected by substance use disorder can call in and find out about. We became fully operational in December of 2017. We are a campaign of the Governor's Don't Let Them Die campaign and funded by the Office of Drug Control Policy. During the months leading up to our opening, we spent several months working on collecting our database of treatment modalities to help have people's treatment ready on the other line of the phone. Kentucky has always been at the forefront of the battles of substance use disorder and continues to do so now. The statewide call center and Operation Unite is proud to be partnered with the Angel Initiative and FindHelpNowKentucky.org. The Angel Initiative has volunteers at every KSP post that can provide transportation to treatment for anyone coming in looking for treatment. Find Help Now is a website. You all have a little post about it on your table. That is an online database where providers log in and can update their bed availability in real time. It's not just for residential, it can be outpatient, intensive outpatient, things like that. So with the call center, our hours of operation are Monday through Friday, 8:30 to 5:30 p.m. We do have a voicemail system left operational all the time. I get emails throughout the night that I check from callers calling in, and if they are in crisis mode, we definitely call within the time that we get them. But all other calls are made after business hours the next day. So at the statewide call center, we often believe that we are sometimes the first voice of recovery that people calling in hear, and that is not lost on us. We want to give them a voice of hope when they call. People are scared. Recovery is scary. You're admitting that there's a problem that you might not be ready to face. Even if people that call into us don't go to treatment that day, we like to think that we have implanted a seed that provides them the courage to do so eventually. Most importantly, we want to treat our callers like someone would treat our family or ourselves or our loved ones. We make it a point to realize that addiction does not discriminate. That is something we've all heard a lot today, but it's so true. One of the most powerful things I've ever heard in my career is that we're all just one bad day away from this happening to us. We heard that earlier when people talked about possibly getting in an accident, anything. One bad day away. It does not discriminate. So we try to take that care and that love into each call. We want them to know they are cared about. Addiction is a lonely world, and they're not alone when they call us. Neither is their family members. We truly try to focus on finding the best treatment to their individualistic needs, because recovery is very individualistic. So, what can someone expect when calling us? Like I said, we do an initial intake screening because we want to make these needs very specific. We want to meet them on whatever they need. So when they call us, we do a very brief intake. We will ask about demographic information, we will ask about history of use, and we will ask about any legality issues. However, people can call in completely anonymous. We try to make it clear that any of the information that is given to us is HIPAA protected. The information that we are gathering is used to help in real-time aspect for prevention and education. When someone calls in to us, we will ask what their substance of use is, so we will know what substances are being used primarily in which areas. For example, a few months ago, some of our primary counties that called in were Eastern Kentucky. We saw that our numbers in methamphetamine use went up. So we know that right now methamphetamine is on the rise in Eastern Kentucky. This allows us to have a look at this war on a ground level, to be in the trenches, realizing what's going on, to get the prevention out to schools, to get the education out to providers, teachers, anyone that may need it, and have a fair fight. So, as I mentioned previously, we have been working on a database that has several different treatment modalities. That would be residential, intensive outpatient, medicated assisted treatment, and other outpatient services, as well as transitional housing, anything that we can think of. We currently have over 740 options of treatment modalities in our database that vary statewide. If it's out there, we'll find it, and we work very diligently to do so. We also manage crisis calls. I like to tell a couple stories about that. These happened within the same week to one of our other screening and referral specialists. She comes running into our office and says, "You have to listen to this call." We think, okay. And she starts playing the call. And we do this often, try to help each other. How would we handle certain situations? Things like that if it was to occur to us. Very hands-on training. And so she starts playing this call, and you hear this very young boy's voice on the phone. And he says, "Is this Kentucky Help?" And she says, "Yes, it is. How can I help you today?" And he says, "Well, I live near the woods in Kentucky, and I have found a newborn baby." And he pauses, and when we're all looking at her, we're like, "Oh my goodness, what?" He says, "A newborn baby mole, and it needs help, and I don't know what to do. It's sick." And so then we all let out a breath, and she's, this is exactly what we need some days, because what we do is very heavy work. And she proceeds to look up a veterinary hospital near him, make sure his mother is nearby, and gives him the help that he needs. Our help doesn't discriminate, neither does addiction. And then on a more serious note, within that same week, the same screening and referral specialist had another call come in. And it was unfortunately someone that was contemplating suicide. They were on a bridge in a metropolitan city in Kentucky, and we could hear the cars going by. So they called us. They saw our number on a billboard, and they called us. And in these situations, we pull together. One person calls the authorities, one person keeps them on the phone. We take it very seriously. These are lives on the other end. Again, how would we want our family members treated and our loved ones treated? So we are able to get in contact with the police, and that person stays on the phone with our screening and referral specialist until we hear the officer in the background and they feel comfortable to get off the phone and they are safe and sound and on their way to help. So how else can we help? We've mentioned that we manage crisis calls and things of that variety, but we try to do a little bit more than just that. When someone calls in for treatment, we understand, like I said, that's a weight on their shoulders that they are terrified. So even if it's the simplest things, I may call a facility for a client that's calling in, check on their bed availability, see if there's a wait list, and then call them back and let them know if they accept their insurance or anything like that. So you may call me and I will say, let me call you right back. I'm going to contact this facility. So I will call you back and say, when you call them, you need to ask for an intake coordinator or an administrator, because some people just don't know those terms and those are intimidating. Seeking help is intimidating. Or, hey, when you call, you're going to need to push number 9 to speak to who you want to. It's just that little bit of confidence that can make the whole ordeal that much better. So unfortunately, we do have some limitations. Due to our HIPAA guidelines, we cannot secure a bed for a client seeking treatment, nor can we make an appointment. We do not ourselves provide financial assistance, but depending on the person, we might be able to find some alternative funding to help them pay for their treatment. And of course, we do not provide direct treatment services ourselves outside from the crisis management area. Also, at the Kentucky Help Statewide Call Center and Operation Unite, we are firm believers and supporters of Casey's Law, and you'll get the privilege to speak to Ms. Wethington, hear her speak in a moment, about this magnificent law. We have, through Operation Unite in the call center, we have hosted trainings that have been directed at family members, judges, and clerk's office. We do our legwork of calling these clerk's offices and these judges' offices to see what their regulations and policies are, so when family members call in, they can have just a little bit more comfort and support through this process, because this is not easy either. We also have an informative packet that has the petitions included that we will mail to anyone that needs, and just a compassionate ear. You know, family members are scared. This often means that they're going to deal with some anger on the other end, because people that are going through Casey's Laws are usually resistant to treatment, but they almost always come out on the other end so grateful to the person that did that for them. Another great service that we offer that is not common and makes us different than most things that have been done is that we have an outreach specialist that follows these callers that have called in for up to a year monthly. So as of yesterday, we have 721 callers out of our 897 individuals that we have given resources to that still participate in our outreach follow-up. Some of those are nearing on their 1-year follow-up. That is almost unheard of in our field, because people are not easy to contact. When we follow up with them, we check in, see of their sobriety status, see if we can help with any other resources, or just see how things are going in general. We've had such a good reaction to this. People are held accountable. People know someone cares. You're calling monthly just to check in. And we always recommend that they call us in between if they need anything or if they just need to chat. So speaking of statistics, by going by our numbers, these are for last month. We have had 2,797 calls to our call center since implementation in December of 2017. That is clients calling into us, professionals calling into us, case managers, which, by the way, is something that we truly enjoy. Coming from the field of working in a rehab and being a counselor, it's hard to know what resources are out there. So to have one common place to call to get those for your clients for aftercare plans or whatever it may be is an amazing opportunity. So make sure that you utilize that. The almost 5,000 calls that we have made out have been us contacting these clients back, contacting these treatment modalities, contacting professionals, and spreading the word of the services that we offer. As of last month, we had 828 individuals that have been referred to various treatment modalities. That's 828 people that have somehow heard the word of recovery and that it is possible. Since October, we have added at least 70 people to that list. As mentioned, we are a service of Operation Unite, and we are so proud to be a part of them. Unite stands for Unlawful Narcotics Investigations, Treatment, and Education. We've spoken a lot about treatment, education, prevention. All of these things will not stand alone. They have to stand together, and Unite does a beautiful picture of that. They have a purpose, and that is that we create hope and change the culture. And Unite has definitely done that. You can hear it from the beautiful testimonies that were shared today. Not only have you heard about Camp Unite and Unite clubs, Unite also has several other programs that I will mention a couple of. Shoot Hoops Not Drugs, which go into the school. On the Move, which targets 7th and 10th grade. And one that we use and work a lot with is the Unite Vouchers. The Unite Voucher is a service that is provided in the 32 counties in southern and eastern Kentucky that Unite covers, and they will pay for long-term treatment for people in those counties to go for at least 190 days at most. In an area that is impoverished, that is a beautiful thing because a lot of people don't have the funding to do that, and long-term treatment is necessary. So we are blessed and honored to be a service of Operation Unite. In closing, I would just like to ask that you please remember our number. Please inform others of this service that we are providing. We make it a mission at the Kentucky Help Statewide Call Center and Operation Unite to let all 120 counties know there is a place to turn to. So far, we've been able to reach a little over 100 of those counties. We want them to know that there is hope, and it can all start with calling 1-833-8KY-HELP. Thank you.
We still have some time left, and so right now we're going to do a question and answer session with our panelists. Dr. Breeding, what would you say are some of the greatest outcomes from the HEAL initiative that you've seen?
Seeing my patients that I take care of in the clinic get their care there, and I had one patient who, when we first started, someone said, if you can, and he'll agree to name because he'll give me the authorization to, is Ricky Day. If you can get Ricky Day to become recovered and treated, then you can do anything. And so within 3 months after treatment, Ricky Day got started. He came to me. His 15-year-old son came to him and told him, Dad, don't you think it's about time you get sober? And so Ricky came in, he had a newborn baby, and he's been in recovery now for over 7 months, and he's doing great. He's having surgery this week and having some metal removed from his leg, which has been causing problems, and having to deal with trying to do surgery on a patient with buprenorphine. We've had to educate University of Kentucky Hospital about how to manage that. So being able to work with patients through not just their addiction and their recovery, but restoring their family. After Ricky started, his wife come on board. She's into recovery now, and they're both have the children, they're raising the children. They're back to taking care of them, and Ricky's wife is thinking about being a peer support person. So that the kind of success that makes you want to continue to treat people. And then the other thing that we used to see is that before we started this program in February, every holiday, Memorial Day, Labor Day, 4th of July, our ER was besieged with overdoses and people who were ventilated from overdoses. Memorial Day, Labor Day, and 4th of July, we did not have a single overdose in our emergency room during the holiday weekend. So that shows me that what we're doing is working. We're working great in our community.
Thank you, Dr. Breeding. Courtney, what advice would you give to current and future healthcare providers on how to help their patients access treatment?
I would say to utilize the tools that are available. We truly are at a time in Kentucky where resources are at an all-time high. This hasn't been available before. We're one of the first states to have a call center like we have, to have the website Find Help Now like we have, and just have an honest conversation with them. Let them know that recovery is possible, that addiction does not discriminate. To get them to want to utilize these tools, we have to make them not be ashamed. And so to spread compassion instead of condemnation, I think would be the most important thing to get them to utilize the resources that we have.
Great, thank you. Dr. Breeding, what words of advice, or how should somebody proceed if they want to start a HEAL initiative in their area, in their community?
Basically, call everybody in your county that takes care of patients with substance use disorder, whether it be counseling, phone referrals, medical treatment, MAT, and get them all together in a group and start talking. Because you'll realize that, as she said, the resources are there. It's just a matter of coordinating the services. And it may be hard for any one of us to make a difference, but by utilizing all the resources and sharing the workload and letting people do what they're best at, it makes it easy. All I have to do is just see my regular patients. And when you come in, I write the script out, talk to you, I have counseling available that takes care of the other portions, and other partners that deal with the other workload. So it's not a hard thing to do. You just got to start doing it. And my cliche always comes back to when you stop bleeding and start treating.
Courtney, could you talk a little bit about how important it is for when somebody makes that decision that they want help? Somebody that has substance use disorder, they want help. How important is it to get that to them as quickly as possible?
It is very important. People don't come to that realization easily, and when they do, they're really in a moment of desperation. I've often heard the analogy used that if someone came into your doctor's office having a heart attack, you wouldn't say, go home, take 2 aspirin, and come see me the next day if you're still alive. And I think that that's very powerful and very true to this. You treat it like any other disease. It's not fleeting. You have to do it then, and make these resources available and opportunities available then, and not wait.
And Dr. Breeding, what have been some of your greatest challenges in creating this HEAL initiative and growing it like you have?
Convincing providers to do it. I mean, they worry about legal ramifications from licensure board, about DEA, about licensure restrictions. We have a lot of bad PR from a lot of the big Suboxone clinics that have turned out a lot of Suboxone street gets misused, and so they're scared to do it. But we'll never be able to change the way it's done unless the primary care doctors take it on. Because if every primary care doctor in Kentucky took care of their own patients, there would be no need for Suboxone clinics that just do Suboxone. We need those patients that need treatment in primary care offices, not in Suboxone clinics where doctors don't know anymore.
That's good. Courtney, how can we spread the word about the call center?
Well, we have just began a new Facebook page on Facebook, of course, and it is the Kentucky Help Statewide Call Center. We post at least 3 times a week. It always has our number. It has information about treatment. I know that geared towards the holidays, we're going to be spreading information about the Angel Initiative, about meetings, NAAA, Celebrate Recovery. So definitely just our Facebook page, word of mouth. We have brochures, whatever it is you may need. Just, social media is the way of the world now also. So just anybody that you talk to. We have cards. I like to tell people to keep them in their back pocket. Again, you're one bad day away. You don't know when it could affect you or a family member and someone could need it.
All right, thank you. That's all the time that we have today. Really quickly, Dr. Breeding mentioned the Recovery Connectors program that we have at Addiction Recovery Care. If you are interested in that, you can email recoveryconnectors@gmail.com. So thank you, and thanks to our panelists.